Good morning. Today I'll examine the serious issue of juvenile substance misuse using data from Anuvia, a renowned rehabilitation and prevention center in North Carolina. I'll also provide a comprehensive curriculum that addresses some of these problems. After discussing Anuvia's effective substance use prevention programs, I'll go into more detail about my vision for successful teen support, including client engagement, treatment methods, program goals, assessment, and potential concerns. Anuvia, a well-known drug treatment and education facility in North Carolina, has a long history of dealing with substance abuse. Anuvia was founded in 1957 and offers a wide range of services, including comprehensive treatment options through its Chemical Dependency Center, as well as prevention and advocacy. According to Anuvia 2024, they emphasize early intervention, particularly among youths aged 13 to 17. Their complete screening method considers family history, employs known procedures such as the CRAFT tool, and includes follow-up interviews to assess the client's motivation for change, as well as the frequency and amount of substance use. Anuvia's youth programs, which are available to Anuvia's youth programs, which are available to educational institutions and other youth-serving groups, promote social skills and abstinence from drugs, alcohol, and tobacco. Their in-person programs in Charlotte are designed for small groups and offer a pleasant and professional environment with a highly experienced team dedicated to helping young people regulate their emotions and make informed choices. Anuvia's intervention focus program is quite exceptional. The 8-week session program includes group discussions, role-playing exercises, and other educational materials. Teaching youth about the physiological and psychological effects of drug addiction, as well as strategies for avoiding triggers and resisting peer pressure, is crucial according to Anuvia 2024. Anuvia effectively employs two major treatment theories: cognitive behavioral therapy, which helps youth identify and change negative thought patterns while also developing healthy coping mechanisms, and psychoeducation, which provides critical information about addiction, its consequences, and its many recovery methods. What genuinely distinguishes Anuvia in its comprehensive approach is its emphasis on the value of families. Parents are actively involved in the intervention-focused program, participating in discussions and activities that teach valuable life skills. According to Sutton 2025, family systems therapy can be an important component for addressing underlying family dynamics, improving communication patterns, and establishing appropriate boundaries. Furthermore, Anuvia emphasizes long-term rehabilitation through extensive discharge plans that include ongoing counseling, support groups, and the establishment of strong support networks. Now I'd like to introduce my proposed curriculum, which I'm calling the Resilient Roots Program. The primary goal of this program is to help teenagers overcome drug misuse difficulties by promoting self-awareness, emotional resilience, and healthy coping strategies. Our target clients are teenagers aged 12 to 17, identified through a variety of routes such as school referrals, parental concerns, or self-referrals, who exhibit early indicators of substance experimentation, have major risk factors, or participate in mild to moderate substance use. The program would follow a hybrid approach, combining weekly in-person sessions in a friendly community center or clinic with a secure online platform for continuous resource sharing and peer-to-peer assistance, ensuring accessibility and ongoing participation. The Resilience Root program would use a holistic approach to rehabilitation. The program combines cognitive behavioral therapy and motivational interviewing. CBT helps kids identify their triggers, challenge negative thought patterns, and learn practical coping skills, such as refusal skills and stress reduction, while motivational interviewing will be essential in strengthening their innate desire for change and leading them through any reservations about modifying unhealthy behaviors. The program would also include other innovative methods, such as mindful-based stress reduction for teens, which teaches self-control, emotional awareness, and how to be present in the moment. According to Hogue et al. 2020, integrated family-based cognitive behavioral therapy is an effective treatment for adolescent drug use issues. CBT helps teenagers recognize triggers, confront negative thoughts, and develop coping strategies. Family therapy promotes healthy communication and boundaries, enhancing the overall treatment process. When combined with proactive family participation, it addresses underlying family issues that may sustain substance abuse. Other important approaches that would be utilized include psychoeducation and contingency management and experiential therapy, which employs modalities such as art therapy or organized outdoor activities to provide non-verbal outlets for expression, fostering trust, and encouraging problem solving in a dynamic setting. Lastly, the program would utilize peer support groups, guided peer support groups, which would provide a safe and compassionate setting for sharing experiences, encouragement, and accountability while recognizing the value of good peer connection. To measure the effectiveness of the Resilient Roots program, a thorough assessment of methodologies is necessary. We would undertake a pre- and post-program assessment using known measures such as the CRAFT tool or the Youth Self-Report technique to quantify changes in drug use and related behaviors. According to Golden and Gross 2010, qualitative interviews with teens and families would provide more specific information in their development and program satisfaction. As indicators of engagement, the program would monitor participation and attendance. At 3, 6, and 12 months following, follow-up surveys would be administered to evaluate long-term outcomes and rates for reoccurrence. Finally, parent feedback questionnaires would provide significant information about perceived challenges in their child's conduct or changes in their ability to regulate emotions and improved family relationships. Adolescent issues, including resistance and lack of desire, are among the challenges that the program seeks to address. It will establish rapport using empathy building and motivating interviewing strategies. Parental participation and confidentiality are vital. However, achieving consistent family engagement is challenging and necessitates deliberate outreach and flexible scheduling. In addition, persistent grant requests and community partnerships are needed to address the ongoing issues of limited resources and money. Finally, public awareness campaigns need to be implemented to discourage substance use, and relapse prevention strategies and continual support is essential. In conclusion, the Resilient Roots program seeks to develop resilient features by offering adolescents healthy options and strong support structures. It stresses early intervention and prevention while providing comprehensive, tailored treatment. Strong family and community ties are essential for establishing a protective network of support. Long-term support and thorough relapse prevention plans are also emphasized in this program. The mission is to advocate for accessible, stigma-free services, nurturing a generation free of substance misuse, and developing resilient young individuals who contribute constructively to society. Thank you.